Meru is one of the counties located in central Kenya, 180 kilometers northeast of the capital, Nairobi. It is home to over 1.5 million inhabitants, and amidst its picturesque landscapes is a multitude of challenges. Limited employment opportunities result in restricted income, subsequently denying people access to quality healthcare. The M-Pesa Foundation and Zuri Health made concerted efforts to narrow the healthcare gap for individuals with limited incomes by offering screenings for various ailments, providing medication, and ensuring the continuity of care.
This is a part of the series of the many health camps or other medical camps we are doing across the country. Actually, I should say this is the ninth within the series. And the reason is to bring healthcare, affordable healthcare closer to the people. And it's part of what we believe in as a Safaricom, as the foundation, and Safaricom as a business. It's through kind of like giving back to the community and working closer with the community that you ensure they are healthy. And it really has a lot of benefits and contributes in a very holistic manner. And it's our belief that being a part of it through partnership with the different organizations, we will be making a difference in the societies which we operate in.
So we are doing various screening, the cancer screening. We are also seeing the patients who have issues with their dental. We have patients who have eye problems. All of them, they are being seen. We also have women with problems of fistula. Those ones are also being seen.
The common illnesses in Meru County include malaria, pneumonia, cancer, diabetes, tuberculosis, and hypertension. The poor health facilities, lack of medication, low income, and shortage of doctors contribute to the persistent poor health outcomes of these illnesses.
Huwezi enda hospitali upate mandawa. Huwezi enda hospitali huku Meru upate dawa. Mara mingi unaendanga hii sesi unakata hii tikiti ya hiyo nini unalipiswa. Ni karatasi tu itachukuliwa uandikiwe uende ununue kwa chemist. Sasa huna mahali pa kuenda. Ni kuchukua tu karatasi yako na kuweka mfuko na kurudi nyumbani. Hata kama ni kukupa ukupie huko. Kwa sababu huna lingine la kufanya.
Moreover, there is a notable issue of poor medical adherence in underserved communities, which further perpetuate these poor health outcomes. One community health promoter noted that patients decide to stop taking a medication after starting it without being advised by a health professional to do so.
Uko na ugonjwa kama ni wa TB. Na unajua uko na TB. Sasa tukikupea ndawa, wao unakataa kukunywa ndawa, unarusa ndawa kwa kitanda, chini ya kitanda. Sasa utafaidikaje?
However, capacity and resource limitations also prevent some patients from implementing their decisions to follow treatment recommendations.
Kama huna pesa tu utakaa hapo tu bila kukunywa dawa.
These medical camps not only offer complimentary screenings and medication, but also serve as a forum where patients receive education about the significance of adhering to medical recommendations for enhanced health outcomes.
So our connection as a digital health company with the medical camps, we were plugged in to bring in the continuity of the care. So at the health camp today, we register you, we're able to get your details, and once we get your details and you're seen today, this is not a touch and go initiative, we're going to follow you up for the next year. So patients who are seen here today are going to receive follow-up for the next 1 year with whichever healthcare provider they got seen here today with.
Zuri Health utilizes communication channels such as SMS, WhatsApp chatbots, and applications to maintain ongoing interaction between patients and healthcare providers.
So Zuri Health has built different platforms. You can access our services through SMS. This caters to the 65% of mobile phone users who do not have access to the internet. And you can also access our services through WhatsApp. We have a WhatsApp chatbot where you can get access to our telemedicine consultations, book a lab test or order medication. In addition to that, you can access our services through the web platforms as well as the application on your mobile phone.
These technological tools enhance medical adherence through SMS and mobile app notifications, while telemedicine and virtual consultations contribute to a deeper understanding of the importance of following medical guidelines. It is late November and the ongoing heavy rains bring both the promise of life and the shadow of adversity in Meru County. While the rains contribute to approximately 30% of crop production, their effect on the health and well-being of the residents remains adversative.
Huku sana magonjwa huku sana ni pneumonia na magonjwa mengine hii malaria. Hata wakati huwa hii ya mvua hii ya El Nino hii shinda ile huko, watu wengi wanalala nyumba zikiwa na maji, wengi sana. Hata kwetu ni hapa kama Sege, ukienda hapo saa hii kuna manyumba, watu wakiingia nyumba tu wanaweka miguu juu ya mawe, kwa sababu ametandika mawe ndani ya nyumba ni kuwekelea tu. Kulala watoto ni sinda, wanalala kulia kwa sababu ya baridi. Hata uweke mirengeti aina gani lazima walie na kukohoa na kupumua zaidi. Hii baridi iko huku saa hii na malaria ni mingi zaidi.
The correlation between heavy rains and malaria is significant. Although Meru lies at low altitude, malaria is still present, especially in the wet season. The abundance of rainfall gives rise to standing water, a breeding ground for waterborne diseases that pose a constant threat to the health of the local population. Unsafe water sources become a hazardous breeding ground for diseases like cholera and typhoid. One of the key goals of these camps is to promote awareness of preventive healthcare measures and disease management. As part of this initiative, attendees receive personalized education on optimal hygiene practices to safeguard themselves from contracting various waterborne diseases. Additionally, the community health promoters actively interacted with community members during registration process, enabling them to gain a better understanding of their health requirements and in turn empowering them to make informed decisions about their well-being.
Yangu likuwa hapa, nilikuwa nimechoka hapa, nikasikia kama nimewekelewa hata njiwe. Nimeandikiwa niende nipimwe, nikapimwa. Mimi nilipimwa kifua, nikaambiwa kifua yangu ina shida, lakini kulingana na vile nilielezea daktari, akaniambia, aliniuliza tayari kuna hiyo tunaitanga asima. Nikamwambia kuna wakati nilipewa hiyo dawa ya asima. Akaniambia hiyo asima tukuandikie usukue uende na hata alaji wewe uko nayo. Nikamwambia ndio. Niandikia dawa ya alaji na hizi zingine za baridi nikapewa.
Cancer continues to wreak havoc across the world. In comparison to other continents, limitations in cancer care have led to reduced survival rates for cancer patients in Africa. Meru County has a high rate of cancer, especially cervical and breast cancer.
Kuko na kansa ya mdomo wa nyumba na ya matiti. Kwa wingi huku Meru wanasema ni ya nyumba, na wengine wanaenda wanaambiwa hata ya matiti. Na unajua ukiambia mtu aende akapimwe anakataa.
A total of 95 women underwent screening for both cervical and breast cancer at the health camp. 5 women with breast lumps and suspected cases of breast cancer were subsequently referred to the hospital for further evaluation.
So the camp, we have different stations, so you can get a general doctor consultations, you can get screened for diabetes, hypertension as part of the NCD program. There is also the RAMCA initiative, which supports the cancer screening, family planning section, as well as the fistula screening. We also have different child welfare clinics that are supported by Gertrude Hospital now that cater to the health and well-being of children.
Challenge nyingine ni mambo ya disability. Niko mmoja wa disability. Disability hatuchukuliwi vile tuko. Tunadharuriwa sana. Hata ukikuta disability hapo huwezi mpea heshima. wakati mwingine tunatusiwa.
Persons living with disabilities still face various forms of exclusion in different socio-economic dimensions. In the health subsector, about 80% of persons with disabilities do not access quality medical services compared to 50% of the general population that lack capacity to access health services.
Hizi kandi za disability wengine wana na uwezi beba mtu kama huyu umpeleke Kanyakini ama Meru General, ni mzigo. Na ukimpeleka Kanyakini ama General tunaambiwa kuja kesho. Tulikuwa tunaambiwa tutakuwa tunawekewa hizi, tutalipiwa kandi ya NHF disability. Sisi hatulipiwi. Mtu anang'ang'ana anazilipia na wengine wawezi pata pesa. Kuko naye amelala hapo. Sasa utashughulikia huyu amelala hapo ama utashughulikia kandi ya hospitali.
Through the priority triage stations, the elderly, expectant mothers, and persons with disabilities receive medical care, ensuring healthcare is truly inclusive and accessible to all. The camp also provided eye and dental screening services to weave a tapestry of clear sight and improve the oral health of the residents. It is estimated that out of a population of 4.3 million people aged above 50, there are 92,000 new cases of visual impairment. Of that number, 11,600 are blind. During this camp, Lions Sight First Eye Hospital performed eye screenings for a total of 710 patients who exhibited various eye-related conditions. 18 patients were scheduled for cataract surgery. Reading glasses and medications were provided as necessary, and individuals needing further assessment were referred. On the other hand, oral diseases such as dental caries, gum diseases, fluorosis, and tooth wear are a major proportion of Kenya's oral problems. According to the National Oral Health Policy, periodontal or gum disease is the most frequent condition affecting almost the entire adult and children population. M-Pesa Foundation, the county government, and Zuri Health continue to mobilize resources through public-private partnerships to support integrated oral health action plans.
We want to look at partnership holistically, and the partnership is all about creating more value together, bringing your resources and the resources of the others, and eventually enjoying the value accruing out of those partnerships. So we leverage on our capabilities as the foundations, as the business, with experts in the field, for us to be able to kind of like address most of those challenges. We need the likes of the county government, the likes of Zuri and all other partners. So it's all about bringing our expertise and resources in a shared value manner to address a societal challenge like the one you're trying to do here in Mitunguu via this particular medical camp.
Tuberculosis remains a major public health concern in Kenya. About 120,000 people develop TB a year and 18,600 people die from it. In 2022, Meru County recorded the second highest number of drug-resistant TB after Nairobi. During this camp, posterior-anterior chest radiographs were used to detect abnormalities that may be associated with tuberculosis. Apart from the screenings and medications offered, NHIF cover was provided to 10 most deserving patients to eliminate financial constraints while they seek medical care. For Meru residents, this free medical camp has not only been a beacon of hope, but a testament to the power of community-driven healthcare. As we have witnessed the tireless efforts of healthcare professionals, volunteers, and the collective spirit of the community, it becomes evident that good health is not just a personal triumph, but a shared responsibility.
The ability for us to reach as many Kenyans, as many beneficiaries as possible is our ultimate aspiration. The difference we can make, a bit in a smaller way, is the outcome we are all aspiring to achieve with this kind of medical camps.
Yangu ya kusema naweza sema ni asante kwa hii M-Pesa Foundation wakishirikiana na Zuri kwa vile wametutendea. Kusema kweli, wametenda jambo nzuri. Hata Mwenyezi Mungu atawabariki kuanzia siku hii ya leo. Kusema kweli, ni wengi watafurahia, na wengi hawakukuwa hata na kitu ya kukunywa dawa, lakini leo watapona kwa sababu ya furaha.